Live from WTEN, this is News 10 at 4.
Well, we're all waging the war on wrinkles.
And until now, Botox was the gold standard. Today, though, we will show you the new weapon in this war that means avoiding going under the knife. You'll also get to see the results. Most people like the idea of looking younger, but perhaps not enough to go under the knife. Now there's a new procedure in the anti-aging arsenal that doesn't require surgery or extensive downtime. Joining us is Dr. Edwin Williams, a board-certified facial plastic surgeon and patient and well-known motivational speaker, Mercy McLino. Now, in the Wrinkle War, Dr. Williams, first you had collagen injections, then you had Botox. Everybody had to have Botox. Now there's Sculptra, which everybody's calling better than Botox. What is it, and how does it work?
I don't know if it's better than Botox. It's just something different. And something different. Botox works to soften some of the harshness and the wrinkles, but Sculptra is one of those things that adds volume, and that's a component of aging we really didn't have a good way to address before.
Yeah, it's something that when you think wrinkles and you wanted, the Botox would freeze that, right? And you wouldn't have the wrinkles, they'd kind of disappear that way. But the fullness is what is aging at times as well.
Correct.
Or lack of fullness there.
Well, it is. I mean, one of the first things you start to see in the 30s and 40s is a little bit of deflation. And it's not about just plumping up, but a little bit of deflation, you know, in the area around the eyes, around the mouth. And Sculptra addresses that over a period of time.
Now, as we take a look at the animation of the injection, how safe is this substance the brand name is Sculptra, but what is it and how safe is it in the body?
Sculptra is really nothing more than something that we've had for about 30 years, the same chemical composition in a suture, that's a dissolvable suture, that is ground up in very, very fine particles. And what it does when injected causes your body to make its own collagen. It gets broken down and eliminated, kind of like a sugar. So that's basically how it works.
And it kind of pushes the wrinkles, as we saw in that animation there, from the inside out. Now that you hear that it's safe, Mercy, I think the first question, next question of a patient is, does it hurt?
Yeah.
You've gone through it.
Yeah.
Did it hurt?
No, not at all. I mean, there is a poke and a prodding, but most of us know, or I should speak for most women, that you know, it takes a little discomfort, but no, it's not painful. It's very easy. They give you anesthetic, much like the dentist. So you're sitting in a chair and you're comfortable. So
we'll check out your before and after pictures and see what you look like. Are you happy with the results? And what have people told you after you've had it done?
Well, my father, who's 80 years old, and you know, your parents, you always look the same to them. You know, they're not going to say, hey, you really look old today. But my dad said, you know, you really look good, and I wonder what that's about. I like that he couldn't say you had work or you had whatever. It's been subtle. I've had it over a couple of years, and it keeps getting better, which is really, I love that idea that you had no downtime, and it's getting better every day. So,
Dr. Williams, I think that's the difference, too. Some of the other injectables, you have to keep doing them every 3 to 4 months. Here, you have this series, and the results last longer.
Yes. The FDA has cleared this for 2 years, but we're seeing results that last longer than 2 years. So we tell patients 2 years.
Are there any side effects or any places on the face that you can't use them?
There are a couple places that it's not advised. Around the eyes, okay, in particular, and in the upper lip. And there is a 2 to 3% chance of nodules. In other words, you feel these little lumps. It really is technique dependent, and I've been using Sculptra for a couple of years. We do a lot of it and have had a couple of these that are kind of self-limiting and go away. So it is safe, but it's got to be used with the right technique.
And we know this is one of those things where not every doctor can get it. You're a certified trainer for it, and this is being limited to plastic surgeons and dermatologists. So that's the other key in this as well.
They're looking at the core specialists. They want to make sure that it's in the hands of people that are very well trained.
Dr. Williams, thank you very much for joining us, and Mercy for sharing your story. Elisa?